We're going to talk about recommended practices and policies. In some areas, the things we're going to talk about are not recommended. They are state mandated, or at least by the licensed Board of Nursing in your area. They have position statements on some of the things that we are going to talk about today.
What are some of the possible consequences of using sedation? Well, we know we can have respiratory depression. That's what the drugs say right along the label. We know that. We know that we can have airway obstruction just by creating a relaxed state. Tongue can fall back. They don't breathe so well. We know they can go apneic. From the depression, it turns into apnea. How about hypoxia? Well, you don't want to wait till they turn blue. That's what we used to do in the old days. Now, this is almost worse, and that's brain injury or brain death. Because now you've really left the family with something they got to deal with for sometimes months and sometimes years. You don't want to go there. Patient evaluation. You've got to have that on board. Medications. You've got to make sure not only you've got the medications, but you also got to make sure they got the right dates on them and that kind of stuff. How many of you been through JCO inspection? Yeah. How many been through more than one? More than two? More than three? I've been through 6 of them son of guns. That's a good enough reason to retire right there.
So what about age-specific considerations? For geriatrics, there's not a whole lot to be concerned about, but there is a couple of major ones. Beginning of late adulthood geriatrics is 65 years. The functional age is much more important than his or her chronological age. So I don't care if they're 70, if they act and look and can do the things of a 60-year-old, then that's how you treat them.